Hey guys, it's Meg with Coastal, and we are hanging out here off-site for something really, really special tonight. We are doing our first ever Ask a Vet segment. We are here at Stayton Veterinary Hospital with Dr. Mike Reynolds and Dr. Jeff Brubaker, and they are here to answer all of your questions that you have regarding the care of your pets, your farm animals, pet health, just about anything. So I am monitoring your questions right here. You guys can go ahead, hop on, comment, ask any questions that you want, and our two experts here will go ahead and give you guys some answers. So again, we are hanging out here at Stayton Veterinary, and it is just a wonderful facility. If you haven't been here, we've had a lot of fun setting up and touring around and visiting with everybody here. It's just a wonderful place. So thank you to both of you for having us here and for being here to answer all of our questions. We're really, really looking forward to this. So we do have a few questions that came in early, so we can go ahead and kind of get the ball rolling with those, and then as questions continue to come in, we can go ahead and answer those. So
fire away.
All right, firing away. So first up, we have a lot of equine customers. And one question that we got was, what are some signs that your horse might need their teeth floated, and how often would you recommend having a horse's teeth floated?
Well, yeah, that's your bailiwick.
Okay, so that's a good question. So horses need their teeth floated because their teeth continue to erupt throughout their life. So they'll get sharp points where they're not chewing or in occlusion. So how often is a tough question. If your horse is in performance, you really should probably have them checked annually and potentially have some work done every 18 to 24 months. There's a common misconception that you don't get your horse's teeth looked at or floated until they're older, until they start losing weight. By then, it's not too late, but we may not have been able to solve a lot of problems that we could have solved had we seen them earlier. If you use your horse for performance, teeth are not just important for eating, but they also will help in either in the show ring, or if you're a barrel racer, they can maybe up your speed, things like that.
Awesome. Fantastic. Awesome. Thank you for that. We do have another question. As we're moving into spring, and here in the Northwest, we love to get out with our dogs, go hiking, take them camping, that kind of thing. Is there anything that pet owners can be doing specifically to prepare for and prevent fleas and ticks this upcoming season?
Take it away.
Okay. Well, here at Stayton Veterinary Hospital, we recommend having your pet on flea prevention year-round. So fleas are a problem here year-round. We don't have a season when fleas are not active because we live in a very temperate climate. Ticks are probably more of a problem in spring and summer, but that being said, there's a whole slew of different flea and tick preventatives, and there are differences in their efficacy. So I would recommend that you consult your veterinarian for what they believe is the best for your area and for your specific your pet's lifestyle. So
awesome. Yeah. Thank you. One other question that we have is, do you have any pro tips from your years of experience on administering medication to a cat? Do you have any tips, maybe some medicine that's more difficult, any pro secrets to make the process a little smoother?
Have somebody else do it.
Right.
That's what I would do.
Yeah. Okay.
No, cats can be difficult to give oral medication to. Honestly, when they are not in their familiar environment, they're a lot easier to work on. So actually, when they come to the vet, they tend to freeze rather than try to escape or become aggressive. So they're actually, for my own cats that I have at home, I would much prefer to administer medication to them here in the clinic when they're in their unfamiliar environment than I would at home. So that, I suppose that might be one tip, would be to take them, if you want to do it yourself, take them to an unfamiliar environment. But For cats, it's all about tipping their head back and dropping it to the back of their throat so they don't taste it. Because if they taste anything, they immediately start salivating, and it's a big deal. If you try to force feed them water, they'll have a big response. So
I had a client once tell me that pilling their cat was like force feeding a chainsaw. And that's actually pretty accurate. So there's a lot of good medications out there now for cats that pharmaceutical manufacturers have made that take the oral aspect out of it. So and even more on the way. So your veterinarian would be able to talk to you about those kinds of options.
Fantastic. Again, you guys, we are coming to you live from Stayton Veterinary Hospital here in Stayton, Oregon, and we are here with two experts to answer any questions that you guys have regarding pet health, pet care, anything related to that. Pets, livestock, the whole realm. So here at Stayton Veterinary Hospital, they do large and small animals. So if you have questions about anything from livestock down to your family cat, you guys can go ahead and drop a comment down. I am monitoring them right now, and you guys can go ahead, ask your questions, and we will answer them live for you now. We are going through a list of some previous questions that we've received and getting those answered for you guys, and then as the questions come in, we will go ahead and answer those. So thank you so much for hanging out with us tonight, and thank you to you guys for hosting us.
Yeah.
So very fun. Let's see some other questions that we have. How often do you guys recommend someone bringing their dog in for a dental cleaning, and how would they know that it's time? Is that something that they should just do on an annual basis, or are there signs that they should look for?
Your dog or your cat should have an annual exam by your veterinarian. That's a good idea. There are breeds that need their teeth cleaned more often than others, so your veterinarian will assess. Hey, how do things look under there? There are breeds that truly do need their teeth cleaned annually. A lot of your toy breeds, if you do it once a year, you're going to avoid a lot of health issues later in life. So that's a question for your veterinarian, but there are dogs that need it every year. There are dogs that don't. So and there's a genetic role in that too.
Cool. Awesome.
Yep.
Thank you. We do have a question from Deborah, and she asks, do you guys have any tips on how to best treat or deal with pasty butt in new baby chicks?
Jeff?
No, I don't.
Yeah, no. You've stumped us.
Yeah, I'm not sure
I'm
not sure what pasty butt is.
Yeah, maybe she could be more specific.
So Deborah, if you want to elaborate on what you mean by that, we will definitely go ahead and get that answered for you.
Huh?
Glad I got to say it on camera though.
All right, and we do have a question from Erica, and she says, for dogs, do you recommend a grain or grain-free diet, and which brands do you prefer?
Go ahead. A grain-free diet is not a good idea unless your veterinarian is giving you some specific feeding instructions. So and there are not any diet. Well, there are diets that we would recommend, but I would consult with your veterinarian, and if you have questions specifically, we could answer those off camera. So yeah.
There is as of late there is sort of a, I guess I would call it almost at this point a fad of grain-free, and it may, there's some people need to have a grain-free diet, and that has I think slopped over into veterinary medicine, and there doesn't appear to be a lot of research behind the need for grain-free for dogs and cats. And in fact, as of late, there's, of course, been recently this scare about dogs that are having cardiac disease, and there's been an association between their cardiac disease and grain-free diets. And the studies are not complete, but I would say that the current recommendation within veterinary medicine is that grain-free diets are certainly are not necessary in most cases. So that would have to be a very unique, and I think probably an unusual scenario in which a dog or a cat needs to be grain-free only. So that's that's my take on it.
Excellent.
Awesome. Thank you. Deborah has elaborated on her question, and she says, I got a batch of chicks shipped to me from Iowa and have had them a few days. Several have pasty butts. I have gotten the poo off, but I'm wondering if there is more I should do. So she has a second comment on here that says, it looks like they have it stuck to them and she's been cleaning them, but she wonders if there is something else that she should be doing to fix the problem.
Do you know?
No, I don't. I guess I would say if the chicks are eating and drinking and seem healthy, then maybe this is stress related to travel. You know, there are some diseases that chicks can get that we don't do a lot of poultry medicine. So I'll be honest, that's a question I'm maybe not able to answer.
Yeah, that could be outside of our expertise. I think certainly what you've done so far, keeping the vent clean so that they can't eliminate is important, but I can't, unfortunately, I can't give you specific advice on what you would need to do to resolve that. So.
All right, thank you guys. Let's see here. We are going to... now you already touched on having an annual exam for dogs and cats specifically. As far as our livestock goes, would you recommend the same, an annual farm call, or what is kind of the process for that?
Well, yeah, I think that if you're, especially if your horse is, I think your horse should have an annual exam. They're considered a pet, and in a perfect world we would examine everything annually, but that's not always practical. So, but I do think that horses should have an annual exam because there are things that, particularly dental issues, that can come up that you're just not going to be aware of.
What about the other large animals?
Yeah. Such as?
Well, cattle, goats.
We address those. I guess if you go ahead, Jeff. You could address the cattle, goats.
Well, no, I'd let you finish.
Okay. Anyway, I think that an annual exam is always best. So whether it's a cow, a goat, or a sheep, or what have you, may not always be practical, but an exam is going to be best, at least annually.
Okay. Fantastic. We do have a question from Karen, and she says, my dog licks his feet a lot. What does that mean?
Most likely it means that your dog has some form of an allergy, and so there are sort of some feet licking in dogs should not be confused with grooming like in cats. So generally speaking, when dogs are licking their feet, that is a symptom that their feet are itchy. And sometimes along with that, you'll see that your dog is rubbing its face or maybe actually biting its feet or biting other parts of its body. But licking the feet generally means there's a sensation, they're itchy, there's some sort of inflammation on their feet. And we usually associate that with allergies of some kind. Allergies in dogs are very common. The most common we see is what's called atopy, which is caused by allergies in the environment that they come into contact with. So that might be pollens, molds, dust mites, those types of things. And then further down the list would be like food allergy. But in the scope of allergies, when we're speaking of dogs, you talk to a canine dermatologist, they might tell you that they see food allergy 10 to 15% of the time out of all the allergies they see. So the vast majority of allergies in dogs is related to something that they're coming into contact in their environment. And there are a lot of we have a lot of solutions available for medications for treating allergies. There's allergy testing that can be done, and there's serum allergy testing that can be done to try to determine what they might be allergic to. If a person chooses to not pursue testing, in many cases you can't eliminate the allergen from their environment, and so then we wind up just treating the symptoms, the itchiness. One thing that you could do is potentially your dog may be allergic to just the grass or whatever it's coming into contact with. just cleaning your dog's feet every time it comes in from outdoors may go a long ways to helping with that itchiness. So.
All right. Fantastic. Thank you. We do have a question that is a little more livestock related regarding giving baby calves shots when they are first born. And what should people be giving to those calves when they first hit the ground?
So we live in a very, very deficient, selenium deficient state. So selenium is a vital micromineral for all kinds of bodily functions, primarily muscle function. So we recommend an injection within the first few days of life of a selenium product. And then we also recommend an injection of vitamin A and D to be administered subcutaneously.
Fantastic. Thank you. We have a question from Joe, and he says, we have a 7-year-old dog who seems to be developing small cysts. Should we have those removed, and are they dangerous?
Go ahead.
Okay. Well, that's hard to know for sure. The only way to know for sure what those are, if they are truly cysts, which dogs do get sebaceous cysts, they're benign, and so they're cosmetic. Sometimes, if it's a cyst, sometimes they will rupture and become secondarily infected, and so then they're just more of an inconvenience. And so if it's a cyst, it's benign. It's not something that's pathologic. But the problem is we don't know for sure that that's what they are. So what I would recommend is that you take your dog to see your veterinarian, and they would probably do what's called a fine needle aspirate. And they take a sample of what's inside that mass that you're seeing, and then they would determine what it is. And if it's a cyst, they may say, well, we can just leave it be. If it's not, if it's something that's more sinister, then they would recommend having it removed.
Fantastic. Thank you. We have a question from Branson, and Branson asks, can my German Shepherd dog get sick from eating trout and steelhead or just salmon? We live on the Sandy Am, and I am just curious.
Well, first off, good job calling it a German Shepherd dog. That's actually what they're called. Yes, so all trout can give your dog what's called salmon poisoning. So if you live on a river, your dog is very susceptible to getting that disease, which can be life-threatening if not treated.
Okay.
Quickly.
Fantastic. Thank you. We do have another question, and that is feeding my dog raw food better than regular dry food?
Go ahead.
Well, we joke. Well, anyhow, I do not recommend raw food diets. We have a number of clients that feed raw food diets and feed it very successfully. I think that you have to be really careful about how you handle it. And dogs, just like people, can become very sick from meat that is contaminated or that has bacterial overgrowth. So if you're feeding, if you yourself eat raw meat and it's been contaminated with, say, E. coli or whatever it might be, you're going to get sick. Your dog is no better than you in that regard. They're going to get sick too. So generally speaking, we here, we don't recommend raw food diet, both for the potential risk to the pet, but also sometimes people tend to view handling that food differently, and so I think sometimes it can even put the people at a little bit of risk because you're not thinking it in the same way as you would food that you're eating yourself. So my opinion is I'm not a fan of raw food.
Thank you.
Or dogs, or people.
Well, sushi's okay.
Meat. Yeah. Okay. Let's not go too far down.
Fantastic. We do have a follow-up question, and that is, what should I do if my dog eats salmon? Should I make him vomit?
No. Probably the damage is already done by that point, so you should seek veterinary care. You can, if your dog has eaten salmon or trout or steelhead, you should just assume that your dog's going to get what we call salmon poisoning. So you should seek veterinary care. Yeah,
it's not a salmon poisoning is not a toxin. It's simply they're ingesting this fish, part of the fish or what have you, and there's a fluke that the fish carries. Then that fluke is carrying a bacteria, and that bacteria is what does the damage to to the dog's gut, and so making the dog vomit is not going to be effective. They're still infected, and so they're gonna come down with it unless they've had it before. They can develop some immunity to it once they've had it, but a certain percentage of those dogs can potentially get it again as well. So,
okay, thank you. We have a question from Shara, and Shara asks, I have a boy and girl indoor kitten, about 4 months old. At what age do you recommend getting them spayed and neutered?
I think that for most cats, spaying and neutering is going to be very, very safe between the ages of 4 and 6 months. So that's it.
Okay, fantastic.
Anything to add to that?
well, I think only thing I wouldn't wait a whole lot longer than that, because then they're going to start to develop secondary characteristics that are undesirable in a pet. So
okay, thank you. We have a question from Deborah, and Deborah says she's new to goats. What, if any, vaccines should be done on Nigerian dwarf goats? And secondly, does she need to vaccinate annually?
So yes, there are some vaccines that goats need annually, depending on what you're doing with your goats. If they're pet goats versus whether they're production goats, that's going to change some things. But regardless, there definitely are some things you need to vaccinate against annually. And again, back to the selenium deficiency that we here in Oregon suffer from. A parenteral or an injectable selenium product is going to be a good idea at least once a year, if not twice a year, even if your goat is on trace mineral salt that has selenium in it.
what vaccine?
I would consult your veterinarian specifically, but for us, what's called a CD&T vaccine is what we would recommend as a bare bones annual vaccine.
Deworming.
You want to touch base on dewormer?
No, I'll let you continue.
Goats are very susceptible to internal parasites, so deworming regularly, or at least getting what's even better is getting a fecal flotation done by your veterinarian to make sure that you don't have a heavy parasite load, which involves collecting a fecal sample and taking it to your veterinarian for exam.
All right, fantastic, thank you. We do have another question, kind of a follow-up. We discussed dog and cat teeth cleaning. How often would you recommend brushing a dog's teeth? Is that something that should be done daily? What are the benefits of that, and how often would you recommend it?
Go ahead.
Well, I would certainly recommend daily, but it's hard to be that disciplined to do it every day. So I don't brush my own dog's teeth daily, which I shouldn't say. But so certainly, I mean, just like us, if brushing a dog's teeth daily would be best. And for some dogs, personalities lends to that, and we can do that. But for some dogs, they're just simply not going to tolerate it, and so those dogs will need they'll need a professional cleaning more frequently. But if you are able to successfully brush your dog's teeth every day, that's going to extend the interval it's going to extend the interval between times when you need a professional cleaning. So it's certainly advantageous.
Okay, perfect. Is there any just kind of as a follow-up to that, I know we sell pet-specific toothbrushes in our stores, and that is what you want to use, correct? Because a human toothbrush isn't quite, I've heard their bristles are different, they can be harder on the gums. Is that true? Or what's your thought on that?
I guess I'm of the opinion that, I mean, there are pet toothbrushes that you can purchase, and there is pet toothpaste that you can purchase. The most important part of the brushing is the mechanical action of the brush. Mm-hmm. So the toothpaste is there primarily for the amount of time it spends in the mouth. It's there primarily. It tastes good, so it's to try to make it a pleasant experience for the pet. So that's the primary, in my opinion, that's the primary role of the toothpaste for dogs. I guess I've never heard that. I think the gingiva on a dog and a human is pretty similar. And I think
except gingiva on a dog is much tougher.
Well, right, yeah. So I'm not sure that the quality of the bristle. I'm not sure if that's too critical.
There are some dogs that just won't. Their mouth won't facilitate a toothbrush, so there's finger brushes as well.
Right. Yeah. There's such a variation in size.
Right.
Fantastic. Thank you. We have a question. I am new to cattle, and people have told me not to put my cows straight to pasture because they can get grass tetany. How can I prevent this?
Well, I'm not sure what you mean by straight to pasture, but I mean I know what that means, but I'm not sure that's not really a concern. The grass tetany is a seasonal thing. It's more common in the spring when the grass is growing. It also happens again in the fall when the rain hits again. So there are things you can do to prevent that. Getting a magnesium block from Coastal would be a good idea. No plug for you.
Well,
right. So it's a real thing, and there is something you can do to prevent it.
Okay, fantastic. Let's see. We have a follow-up question, also slightly related to that on the horse side, though. As the spring comes and the grass gets richer, do you recommend phasing a horse into pasture? Or what would the process be to get the horse adjusted to being back out on pasture after the winter?
Oh, your turn.
Yeah, we would. I mean, if they've been in a stall all winter long, or there's been very little grass, if they've been on a dry lot or something like that, then we would recommend, as the green grass comes on, gradually introducing them to pasture. And so that might be, for the first week they may be on pasture for half an hour a day, and then work your way up gradually over the next few weeks. Ultimately, and the concern is they may develop laminitis or founder, and really it's so dependent on the individual. Some horses are just simply genetically predisposed to developing laminitis, and so you can have one horse that just gets turned out and they're out all day every day all through the spring and no problems, and you have another horse that goes out and they're out for 2 hours and they've foundered. So it is very much dependent on the individual, but the safest route is to gradually introduce them to pasture, and then typically in our area here, by the time you get to about end of June, the problem no longer exists because the grass is getting burned down by the sun. So,
well, we've already seen it this year here.
Yep.
Multiple cases.
Wow.
Yeah.
So,
Wow.
Yep.
All right. We have another question, and it is, I am interested in getting into veterinary medicine. How do you recommend I get started? Is there a school you recommend? And do you think I should work for a clinic for a while first?
Well, kudos to you. So I certainly think that spending some time at a veterinary office would be a great idea, because a lot of people think that it's something they might want to do, but maybe you get into it and it's not what you thought it was going to be. So I think that's I don't know how old you are, but that's a place definitely to start. As far as where to get an education, there's not a. As long as you're getting your prerequisites done and you're getting good grades, it really doesn't matter where you go as far as getting into veterinary school itself.
As far as your undergraduate
work,
Yeah.
Yep.
Awesome. Thank you. We do have a question from Chris, and Chris asks, how can I trim my dog's nails without putting them through so much stress, and can you recommend a special tool, as I have used the basic toenail clipper or a grinder, and that does not seem to work without sitting and wrestling with them. I know, as a dog owner, I've been through the same thing,
Right.
so I am excited to hear your answer.
We have a team of people.
Yeah. Dedicated to that.
There are dogs that, for whatever reason, they are somewhat psychotic in about their feet. No offense.
Oh.
So we have dogs that come in here for toenail trims because their owners can't do it. They're better here, like Jeff had said. Even dogs sometimes are a little more subdued here, that like cats are. Some dogs need medication. Talk to your veterinarian about saying, hey, can I get something for my dog, either before you take it in there to have its nails done, or you do it at home. And a special tool there. You want it to be a high quality toenail trimmer for pets. Don't, unless it's a cat, don't try and use a human nail trimmer. You're not gonna have any fun there. So.
Dogs simply, a lot of dogs just simply have a phobia. It's having their foot held onto. So it's not that the trimming is painful.
Yeah.
What they're reacting to is the squeeze basically, and I think it's kind of a natural response. They want to pull back, and when they can't pull back, then they kind of hit the panic button. So there's not, unfortunately. So in my mind, the best thing that you can do is sort of try to desensitize your dog.
Yep.
So you're sitting on the couch, whatever you're doing, reading a book, whatever it might be you're doing, and play with your dog's feet, and even get them used to you touching it, and it's not a big deal. That would be the best advice I could give, and even sometimes that doesn't always solve the issue.
If done incorrectly, it can hurt. So
right.
Or if you're using an instrument that's dull or whatever. So a good instrument that you're not taking too much off.
Fantastic, thank you. We do have a question on here, and it is, I have read that it is safe to give dogs Benadryl as an antihistamine. Is that true, and what dosage would you recommend?
It is safe to give dogs Benadryl. I guess it depends on what you're using it for. We use it on occasion here for like a reaction to something like a bee sting or something like that. A dog comes in, its face is swollen or has hives. We will give injectable Benadryl. It is not really. I have a lot of clients that will try it for allergies, just for itchiness, and it is not effective. It in some cases may appear to be a little bit effective because it does cause drowsiness in dogs just like it does in people. So if they're too sleepy to bite or lick, well then that appears as though it's helping with the itchiness, but it really probably does very little for itchiness. So I guess I wouldn't. I don't see a lot of value in Benadryl, generally speaking, for dogs.
Yeah. All right, thank you. We have a question from Kat, and Kat asks, my cat chews on zucchini, potatoes, and bananas if we leave them on the counter, but no other fruits or veggies. Is she missing something in her diet? That's a good one. That's a good question.
Yeah, that's a common question about, is my animal missing something because it's eating this? And no, she just likes those things. Yeah, she's not missing anything. Well, she might be, but that's not why she's eating those particular foods. She just thinks that they taste good.
All right.
Yeah.
Thank you. We have a question from Brittany. And Brittany says, my 3.5-year-old gelding has very thin hips but a large belly. Is this because he's still growing or just hasn't been worked with enough to have built up enough hind muscle? He is currently on free choice hay and grain. Should they be adding supplements in to aid in building muscle?
Well, we would suggest that this is a point where you probably need to get some veterinary attention, directly looking an exam. So that's going to be hard to answer on this forum.
All right, thank you. We have a question from Rachel, and she says, my German Shepherd dog seems to have anxiety. He is currently whining no matter what the case. He is fed at the same time each day. He has water access, regular potty breaks, but he is always whining when he's just laying down or even sitting next to you. Best tips or recommendations to help him calm down some?
How old was he?
We do not have his age on here. Rachel, if you would like to go ahead and comment with
I
your...
can comment.
Oh, okay.
Whichever. So that could be anxiety. Certainly, dogs absolutely do get anxiety that needs veterinary intervention. Depending on the age, it could be pain response to something. So I think that this is something to discuss with your veterinarian.
All right, perfect. Thank you. We have a question from Lori. Lori says, what about food allergies with dogs? My dog is a German Shepherd dog lab, and she is licking her feet all the time. The groomer said she had moisture in her ears.
You did such a good job the last time. That's a good answer to the question.
So I guess the couple questions there. I guess she's licking her feet. That could be that she has. It could be that she has food allergies. It could also be that she's just allergic to something in her environment. And in fact, that's probably the more likely thing. It depends on age. Usually we'll see like food allergies showing up in dogs that are younger, probably less than 3 years of age. Not to say that environmental allergens can't show up then as well, but sometimes that might help give us some clues. But it's also, if I don't know exactly what the groomer was seeing as far as moisture in the ears, but that might indicate that your dog has an ear infection, which would be typical of an allergic problem. So whether that's environmental or a food allergy, hard to know for sure. The problem, so you could do what's called a food trial, but food trials are actually really difficult to make work because so most things, dogs are primarily allergic to proteins in their food. So to do a food trial, you need to choose what's called a novel protein to that pet, or a new protein that dog's immune system has never seen. And in order to do the trial, basically you have to go for at least 8 weeks, and they get nothing else. So nobody drops food on the floor. It's just really difficult to really do an accurate food trial. So I find that most of the time my clients either get discouraged or just frustrated with trying to do the food trial. And so I think we have a lot of other good interventions that we can do for allergies that sometimes aren't necessarily related to food.
As Dr. Brubaker mentioned earlier, food allergies are not even close to the most common type of allergy we see, presenting as skin problems in dogs.
Mm-hmm. Awesome, thank you. Just a follow-up on Rachel's question from earlier. If you remember, just to recap, she had the German Shepherd dog with some anxiety, and she says he is just over a year old. We do think it's mostly because he needs fixed, but he does also get regular exercise. So just a comment on that.
Rachel, I don't know if I have a lot more to add as far as that's concerned. Certainly, neutering is always a good idea if you're not going to use them as a breeding dog, but I still think probably you're going to need to seek some veterinary help to get that sorted out. Sorry, I can't be more specific.
Perfect. We do have a question for each of you to answer separately, and that is, what is your favorite species to work on and why?
Dog.
Cat.
Cat. Dog and a cat. Any reasons behind those?
I'm a dog guy. I don't know.
Dog guy. All right.
Because cats make you look really good. They know how to heal.
That's true. That's a good point.
No, I certainly enjoy both, but I think
I like them all. I'm not going to pick a species. Sure.
Okay, sure, fine.
Yeah.
All right. All right. We do have a question here from Tina. And Tina says, ooh, this is a medication that I'm probably going to butcher, so you guys might have to help me out. I have a boxer who is 7 years old who is on, it's for seizures, phenobarbital. Yeah. The last week she has started having a shaking like she is cold, chills, but it's not cold in here. Is this something to be concerned with?
Yes. If there's any behavior change or change in demeanor or appetite or what is a cause for concern, but sounds like you must have a relationship with a veterinarian. So I would I hate to keep punting, but I would consult with your veterinarian about that.
Awesome. Thank you. And let's see here. We do have a question regarding dogs. I have a very active 5-year-old dog. Should I look at putting him on a joint supplement, and why?
Go ahead.
That's a good question. Joint supplements are one of those things that we recommend joint supplements, and we recommend joint supplements because we think that they should work. But in my estimation, and I'm not alone in this, there are not a lot of so none of the over-the-counter oral joint supplements are FDA approved products. So therefore that means they haven't gone through testing to show that they are efficacious for what they're designed to do. So we think that joint supplements should be effective, but the questions that are often come up is does the product get destroyed as it makes its way through the stomach, through the acid in the stomach? So I think there is value in there is potentially value in these joint supplements. They are not going to be harmful,
right.
And so I think that's the reason that we would do that. More specifically for joint supplementation, I think having your pet on omega-3 fatty acids is that we know that that's valuable. Omega-3 fatty acids have been proven to have anti-inflammatory effects, and so that can be joint protective. So I think there's very good studies to show that omega-3 fatty acids can be very useful for joint health. So those, I guess that's the information that I can give. Do you have anything else that you would add to that?
All right, thank you. We have a question. My dog suffers from severe anxiety from fireworks. Is there something over the counter that I can give him, or would it be best to take him in and get something that is a prescription?
Yeah, unfortunately, there's not anything I'm aware of over the counter that's going to be effective, particularly if it's severe. And there are some. We have some pharmaceutical options that are perfectly good. There's a relatively new product that your veterinarian will know about that is for noise aversion. So that is pretty exciting because it works pretty well and doesn't have any side effects. So I would talk to your veterinarian about that.
There are over-the-counter products available, but if
Right.
you have a problem that's that significant, you're probably not going to get the positive effect that you're looking for.
Right.
Okay. We do have a follow-up question from that, and that is, are the CBD products you find at stores good for calming my dog down with fireworks or anxiety issues?
I don't know.
Yeah,
We as of yet we don't prescribe CBD products. Because we don't. It's too new for us, so we just don't have enough information. Yeah. There are studies that are ongoing at Colorado State right now. I know I'm sure lots of other universities that have studies in play, but the results aren't available yet, and so we have not entered that arena yet. I'm sure that is coming, but I have no knowledge to help.
Okay.
That. Yeah.
All right.
Good answer. Yeah.
All right. We have a question from Diana. Let's see. This came in two parts, so I'm going to kind of sum this up for you. She has a 5-month-old dog that looks like is a large 45-pound puppy. She bought Advantage 11 at her vet's office last week, and it is not working. What now? Any suggestions?
What's the problem?
Probably Advantage 2.
The Advantage 2.
Oh, Advantage.
Yeah.
Yes.
It's not working.
It's not working.
For what? For fleas, I mean.
Sure.
We're still scratching.
Flea medicine, yes.
Are you still seeing fleas? You can send that in. Are you still seeing live fleas? I think that there are. I would be curious to know if you're still seeing live fleas. Maybe it's another issue.
Well, if the pet is still itchy, and the pet does have a flea allergy, you may have eliminated the fleas, but the allergy is
right.
It takes a little time for the allergy to calm down. So, yeah,
be unusual in a 5-month-old, but not
Yes.
impossible.
All right, thank you. She does have a follow-up question. Again, her dog is 5 months old. When should she get her first rabies shot?
Well, they can get a rabies vaccine as early as 12 weeks of age. So I would say anytime is a good time now.
Anytime. County's going to require her pretty quick. So.
Yeah.
All right. Thank you. We have a kind of another question from Christina. It looks like she hopped on and commented kind of at the tail end of the CBD conversation. And she asks, what do you think about the CBD oils? So is it still kind of the same?
There again, I don't have any knowledge to comment.
Answer's the same.
Answer's the same. Awesome. Thank you so much. I'm just going to scroll here and make sure that we have not missed any comments because we had quite a few come in quickly. Let's look here. While I go ahead and look, do you guys want to give us a little bit of a background on how long you've been here in the community of Stayton and this building? It's beautiful, and I heard it's fairly new. Is that correct?
That's
Yeah.
That's three. Is it? I think it's 3 years old. 3.5, 4.
Yeah,
Coming on 4.
Yeah.
Yeah. We've been in this building 4 years. I've been a veterinarian 20 plus.
Obviously longer than me.
I don't know if you heard that or not. 20 plus years. Jeff and I have been veterinarians here in Stayton for 12 years. So that's my story.
Awesome.
Yeah, we've been here for 12 years, and I've been a veterinarian now for 16 years and
16 years.
12. So most of it right here. In
Awesome.
Stayton. So enjoying it.
Fantastic.
Yeah, it's a privilege to work here.
Great community. We love it.
Awesome. All right. Well, we have another question that I missed. It is, I have a 19-year-old fox rat terrier on Dasquin for arthritis, and it's working great. We are wanting to keep him comfortable and active for as long as possible. What other recommendations do you have in addition for senior dog health? And are there any vitamins or supplements for overall health that you recommend?
How old was the dog?
The dog is 19.
Good water.
So, well, I'm not going to plug a lot of products, but if you're going to choose an oral joint supplement, I think you picked the best one. So, good job. I think that's a question. You're doing something right. Let's put it that way. That's a question for your veterinarian. An annual exam and their recommendations are going to be the best bet to keep your pet comfortable and healthy long term. As far as I don't have any vitamin mineral supplementations that I would recommend based on just age necessarily, but I do think that Dasquin certainly would be my choice for a joint supplement to try and prevent the onset of degenerative joint disease.
Yeah, and I would say too, if your pet is to the point where it's no longer comfortable and you think that it has arthritis pain, then you would talk to your veterinarian. They might prescribe a non-steroidal anti-inflammatory, and that's gonna be more potent, but that might extend good quality and good comfort for your pet. And along with that, they would more than likely recommend some lab work just to make sure that your pet could tolerate a non-steroidal anti-inflammatory. But yeah.
All right, fantastic. Thank you. Let's see. We have a question from Rochelle, and she says, I have an alpaca with elephant skin. She is a 4-year-old female. What can I do to get her relief? And do you know of anybody in the area that would be willing to use her for study? I've read a lot of alpacas have this issue.
Go ahead.
I don't think I've actually ever seen that. So I would defer to Oregon State University for that because
I'm not sure.
They are indeed expert on camelid medicine.
Right.
So but I don't know that they would take it for study.
No,
I don't think, but
I don't think they would.
But they would.
I'm not
they would,
sure what your condition you're referencing, but
yeah. But they would most certainly be able to, I'm sure, tell you what the problem is.
Right.
For sure.
Okay, perfect. Let's see. I have a question. I have a 4-year-old German Shepherd dog, and we are out at the beach and in the woods during the summer, is there something that you can recommend for me cleaning his ears?
I think in regards to a basic ear cleaner, most any of the over-the-counter products are going to be pretty doggone safe and effective. I'm not going to say they're all effective because I can't see them all, but I would be comfortable telling you that an over-the-counter ear cleaner is going to be pretty safe and effective to help break up wax and minimize the onset of wax buildup, which is going to promote ear infections, things like that.
The majority of them are probably alcohol based, and so they're drying.
Right.
So that's going to promote good ear health too.
Yep.
Okay, fantastic.
A lot of German Shepherd dogs in the community.
There have been quite a lot
popular
on here. Yes. Let's see. We have a question from Chris. I live in Central Oregon, and I know that our soil lacks selenium, which we did touch on. Mm-hmm. They don't want to lick the blocks. Do you recommend that I put loose salt on their hay? I don't want to overdose them at the same time, or is that even a possibility?
Yes, overdosing is a possibility, particularly with just the salt portion of it. And selenium also, but it would be more, in that regard, be more the salt you might be worried about.
This is for horses?
Chris does not specify if it's for horses.
Loose salt is best in general, particularly for ruminants, cattle, sheep, and goats. But loose trace mineral salt is going to be better. Horses are going to, a block is going to be effective. You're in Central Oregon, so you don't deal with the moisture issues that we have over here with salt outside. But if they're trying
to get enough selenium in their horse, I would recommend some kind of a selenium supplement. So whether it's horse guard, or whether you use like a selenium yeast or something like that.
Yep.
I think best for maintaining adequate selenium supplementation is a daily supplement with the feed.
Right. If you're talking about a horse. Right.
Yeah. Right.
Yep. But again, in our area, you're going to want to have you can go overboard a little bit on selenium.
Mm-hmm.
Yes, we're low, but we actually test a lot of horses, and we can have horses that live in the same place, and this one's fine, and these 3 are low. Don't ever see any that are high, I guess, unless they've been over-supplemented. We have had some that have been over-supplemented, but we recommend annual testing on horses because we are super low, and it causes some pretty significant disease that can go present in many ways. So talk to your veterinarian about that.
I'm not sure if this will change your answer at all, but Chris commented and he said he has Dexter cattle.
So loose salt. It's going to be best. Trace mineral, loose salt. But again, just like with the goat question earlier, at least annual or biannual supplementation with an injectable product is going to be prudent. And you're going to be I'd be very comfortable telling you I don't think you'd overdose them.
Okay, thank you.
Yep.
I have a question from Haley, and Haley says, my dog won't let myself or anybody else near his ears to clean them or put medicine in them, but gets infections a lot. I haven't been able to finish any medicine he gets because he gets so stressed and upset when you come close to his ears. Is there a way you guys know to help me calm him down or clean his ears without the liquid? He does okay with Q-tips sometimes for the upper part of his ear.
Camera's on me. I would suggest veterinary intervention for this dog. Because the ears may not be a bad dog, but the ears just may be very painful, and sometimes might require sedation to get them appropriately cleaned. And there are some medications your veterinarian can discuss with you that don't require daily treatment.
We have products available specifically for dogs that are difficult. I mean, there are treatments that you can instill that are effective for 2 weeks at a time, and so that would eliminate the need for you to be daily manipulating your dog's ears, which it's probably simply painful, and maybe also giving some oral medications to control both the itch as well as to maybe provide a little bit of anxiety relief associated with it. So I think there's probably some solutions available for your dog.
All right, thank you. We do have a question regarding your opinion. We would really like to get a bulldog type dog for our family pet, but I have heard that they have a lot of eye, nose, and joint problems. Is there a specific breed that you recommend getting to lessen these problems? Or I guess maybe I'll add on to that. Is there any maybe preventative care early on to lessen those problems?
Eye, nose?
Eye, nose, and joint.
Okay.
I would add in skin.
And skin.
Bulldogs are great dogs, but they do have, of all, there's varying bulldogs, English bulldog, French bulldog, they are more prone to eye problems. They are more prone to skin problems, like Dr. Bibicker mentioned. Nose problems, yes. Joint problems, wouldn't be highest on the list. They can get some problems with their patellas, but
I don't know that there are a lot of. I'm not sure that there's a lot of things that you can do to prevent a lot of the.
Yeah.
A lot of these problems are genetic. This is the way the dog was designed, and so with that comes some of these health issues,
Yep.
and that comes with the territory. That's part of.
Got that with the look.
Yeah, that's part. Yeah, you're going for a certain look and maybe personality, and so. But along with that comes some of these other issues that you will probably wind up having to deal with, whether it's skin issues, from allergies, or whether it's
Palate issues.
So a lot of these short-faced dogs have breathing, upper airway problems that might require surgical correction, and so there's really nothing you can. Early surgical intervention makes for a better life for those pets, but as far as just sort of like at-home preventatives, there's not that I can think of.
Yeah.
No.
Okay. Thank you. Just so you guys know, we are going to wrap up in about 5 minutes. We don't want to take all of the time of the doctors that are with us tonight, so we will wrap up shortly. If you have any last minute questions, please comment them below. We will squeeze them in. Again, we just want to say a huge thank you to Stayton Veterinary Hospital for hosting us tonight and answering all of our questions. You guys asked lots of great questions, everything from horses to livestock, and apparently there are a lot of German Shepherds in our coastal family.
Right.
So there are. Again, thank you so much just to the two of you for having us here. We
Not
really
nearly as terrifying as I thought it was going to be.
Thank you. This has been fun. Yeah.
awesome.
Yeah.
No, we really do appreciate your advice, your medical opinions, and also understanding that everyone watching is probably working with a veterinarian that has seen their animal, and we really appreciate you referring them to their local vet for further information as well. So thank you for that. We really appreciate having you guys be here with us tonight. Hopefully we can do many more of these in the future. It would be fun to do
We'll get some of the other doctors to do it.
seasonally and get a lot of people in here and get your opinions, answer our questions, and we just really appreciate it. So thank you so much. If you guys are in the area and you are looking for a vet for your animals, I would definitely highly recommend stopping in here, meeting with the doctors. They are accepting new clients, and this is just a wonderful place. I think you'll have a great experience. So thank you so much for hanging out with us tonight. We appreciate it so much, and thank you to everyone who asked questions. We will see you next time.